going. Good morning, welcome to Doc Talk Live. I'm Dr. Brad Goodman, today's host, or the host. I'm with Dr. Billy Lapidus. Billy, I'll give you an elbow bump, how's that? Dr. Lapidus, I'm going to just call you Billy because I'm more comfortable with that.
Yes.
Billy is a specialist in infectious diseases, and so you're knee-deep in COVID, and so I wanted to, hopefully we'll get some people that see us live, but if they don't, I'm sure there will be questions later. But I wanted to sort of talk to you because you're in the trenches of COVID. And so just even sitting here, we had a whole discussion about how close we can sit, wearing a mask, not wearing a mask, the assumption from Lucy, who's doing my videography today, was, oh, you're both COVID negative, blah, blah, blah. So there's so much going into all of this, right? So how did we end up with a mask? You know, how did we end up, this whole thing? Tell us your thoughts.
For me nowadays, wearing a mask, is as essential as wearing my wedding ring. I mean, it's as comfortable for me. I feel naked. I feel like there's something missing if I'm not wearing a mask. So I will be honest with you that I think, and I've told you this, that I have had COVID myself, a mild case a while back. Despite all my safe practices, I had COVID, and I know that I am antibody positive and that I probably do not have to wear a mask, but I am far more comfortable in a mask, and I think it would be confusing and misleading to others if I didn't wear a mask. So I'm just more comfortable.
So would you have to, if you didn't want to wear a mask, okay, and you've had COVID and you have antibodies and you are non-infectious, so you know that medically speaking, you don't need to wear a mask. You're not protecting yourself from anybody. Would you have to check your antibodies regularly to make sure? How would that work?
This is a great question, and no, I'm not going to be checking my antibodies regularly. I had not intended to do that, and that is another reason, because we don't know how long lasting these antibodies are. We don't know how long the immunity lasts, and therefore I'm going to, better safe than sorry. I'm going to
So
always
it's possible. So it's possible, even though you've had the antibodies, it's possible that you could catch COVID again.
I suppose so. There's not a lot known about that. We know that there has been a case or two here and there reported of people
So
getting it twice.
Unlikely. It's
I
unlikely.
think it's unlikely, but I'm not taking any chances. And I am going to be careful and safe and try to encourage all others to do that. And if I take my guard down, if I take a mask off because I feel like, oh, I'm immune, I've had it, I can't, it's not only not right for me and uncomfortable for me to do that, but it sends the wrong message. And it's confusing.
Well, everything is confusing
Right,
about COVID.
right.
Like we need to talk about quarantining and when to test and when not to test. Every aspect of this illness is confusing.
True.
And I will say that ultimately, I think we need an app on our phone that tells us where we are in this COVID process, whether you've, let's say, COVID negative, never been exposed, blah, 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 or I've taken the vaccine, I've got antibodies, whatever. There needs to be an app on the phone that allows you to show, if you go to the airport, like you show your driver's license, you show where you're at based on COVIDity, let's say. That's what I think, but what are your thoughts on that? How is this going to work, let's say 3 months from now, 4 months from now, when you've got a population that's, let's say, COVID negative, COVID positive symptomatic, COVID positive asymptomatic, vaccinated, and so again, I'm making a plea for an app on the phone that says where everybody's at and what the protocol should be.
It would be great. That would sure be ideal if there was such an app. If all the answers were right there in our phone, or if things were clearer. But things, as we all know from these past many months, things are not at all clear. And even the experts don't always have all the answers.
My fiance has 2 children, and their COVID policy is is if a child is exposed to COVID at school, like somebody tests positive, then they have to quarantine, yet not necessarily be tested. So they can't show up at school.
Right.
You follow me?
Right.
But what they do on their own time, the school doesn't care.
Right.
So it's a very confusing message.
So confusing.
Why not just test the child, and if he tests negative, wait 4 days, retest him, and if he tests negative again, let him go back to school.
It's so interesting that you say that, and I guess we could all be tested every day. Everybody could be
Yes.
tested every day, you know, as an alternative to having this app that you're talking about. Let's just
Well,
get
it would download on the phone.
Right,
The app would pick it up. It would pick up the test, and it would say where you're at. But the reason I mentioned double testing is because of a couple reasons. One, if you're exposed to COVID and the incubation period, from what I understand, is a week or 4 days to a week, you may not catch it if you test immediately.
Exactly. That's
so
exactly true.
So you wait several days and you retest.
Sure.
And so, therefore, and then also you have to deal with the fact that your test could have been a false negative.
Exactly.
So again, these policies are just, it's like we've got policies in the operating room that you've got to let the betadine dry for 3 minutes before you can start a procedure. But that has to do with fire precautions, and I'm not using cautery. So there are no fire issues, and you're just waiting there 3 minutes to pay homage to a rule that has no basis in science. So I'm frustrated, Billy. Can you tell?
It is very frustrating, and I'm frustrated and constantly humbled and anxious because I am called upon to be the expert to know everything.
Exactly.
I'm supposed to know everything.
Exactly.
Which if you ask my wife or kids, they will clearly tell you, they will like laugh, because so we all do the best we can. That's all we can do.
Sure.
And the other thing that so makes it more confusing and frustrating is that, you know, the CDC has its guidelines, right? The Alabama Department of Public Health. Everybody has their guidelines, but then every institution is allowed to interpret and follow those guidelines as they see fit according to their own institution.
Okay.
You know,
Well, let's
so-
just talk about testing. Should you test if you're asymptomatic
If you're
and exposed to somebody?
If you're exposed, the CDC is recommending that folks who are exposed be tested, but more for contact tracing, more to just know that that person is COVID positive, whether asymptomatic or not, just to know.
So should they be tested twice then?
Well, see, but yeah, so the question is, if you get tested and it's negative, you know, like you said, you may test too soon. There is an incubation period, you know, 2 to 14 days. That's a wide range. You can be tested on day 3 or 4 and be negative and give you a false sense of security, make you feel really good you're negative, but you could end up converting and becoming positive on day 5 or 6.
Exactly.
You weren't tested.
So should you test twice?
Well, you know, it depends on why you're getting tested.
Well, the
question
example you gave is you were exposed to somebody
Well, you're
and you're asymptomatic.
The question is, and the reason obviously to test, besides contact tracing, is to determine when one can be removed from quarantine, right? When can you comfortably return to school? When can a healthcare worker comfortably return to the hospital?
Right.
And when can you trust a negative test? Can you trust it the day after exposure? No. Can you trust it at 7 days after exposure? And if you have a negative test at 7 days after exposure, might that give you the security and your supervisors and your administrators and your principal?
And the answer to that question is?
Well, the CDC has just recently come out with new exposure guidelines, management of exposures, to say that, first of all, has always been 14 days after exposure that you must quarantine. Well, they've reduced that to 10, and they've reduced it further to possibly 7 if you have a negative test at day 7, or they enable you to get tested at day 5 after exposure and return to work or school at day 7. after exposure if that test at day 5 is negative. So the rules are constantly changing, and institutions like hospitals and schools are all interpreting it their own way and doing the best they can, doing what they believe is right for their students and their employees. But the fact is, a negative test at day 7 after exposure is now allowed as a way to return to work or school early, to be removed from quarantine early. It's not the 14 days anymore.
Super. So you said you had a mild case of COVID.
Right.
So I'm curious, how did you treat your mild case, and when was this? Was this in July? How long ago was this?
No, I'll be honest. My wife. This is so ironic. My wife had it first, and I got it from my wife. As much as we've tried to isolate from each other and quarantine, household exposure. What do they say? 60% of folks exposed in the household are going to get it.
Okay.
Because you can quarantine and you can be apart. But so my wife had it first. She was very sick with it. Had it for 2 weeks, and this was, let's say, at the end of September that she had it for 2 weeks. And then I was tested immediately, and my kids were tested because we were exposed to, or we were negative. A week later, I started feeling a little bad, just a little fluish, a little feverish, a little achy. Never had a cough or shortness of breath. And I got tested again, and I was negative. But I didn't feel right about that. Because
so you had 2 negative tests now.
2 negative tests.
Okay.
And this is the.
But now you're having symptoms of a viral infection.
When I had a negative test, one of those tests.
And so
was
then
negative.
what do you do?
So I was obviously extra careful. I was considering the possibility, it's reasonable to do so, that there's so many viruses out there that this may be a viral illness that's not COVID.
Sure, exactly.
The flu.
Exactly.
Or some other respiratory viral infection.
So how did you figure out that this was
Because I got tested again.
A third time.
I was not comfortable going back to work, or...
And what test did you get?
I got the PCR.
Which is what? Is that the nasal?
Well, actually, so the 2 tests that are out there, the 2 main tests are a PCR test and an antigen test, which has lots of different names depending on the vendor, the person who makes it.
So what's the difference between the tests?
The PCR is DNA, or RNA. It's actually checking the RNA of the virus. So it is accurate. It is the gold standard.
And how do you get the sample? Is it from blood?
It's from a nasal swab, either a mid-turbinate swab or a nasopharyngeal, which goes farther back.
So is it possible that you had a PCR and they just didn't stick the swab far back enough?
Absolutely. So you have to consider the testing, and it may be that it missed it, or it could just be that no test is perfect and there's going to be a false negative rate or a problem with sensitivity.
So what was the other test that you said, the antigen test?
The antigen test is really imperfect.
And how does that work?
Imperfect.
How does that one work?
So it's not measuring so much the DNA or the genetic material of the virus. It is actually measuring the antigen, which is an immune response to infection, or a particle of the organism.
Is that a blood test though?
No, it's also a nasal test.
Okay.
But it's imperfect. Its sensitivity, meaning the likelihood that it's going to pick up the infection, is much less than the actual PCR. And it actually is not only a problem for false negative tests, but also some false positives.
So I'm switching gears for a second, but take me back to Nick Saban, because I remember he's got a football game coming up. He tests positive, and then he has 3 negative tests, and they allow him to coach the football game. So is it possible that those 3 negative tests were just bad samples?
It is, and one might also have to consider whether the initial positive test was a false positive.
Correct.
If it was an antigen.
That's the assumption.
If it was an antigen, so if his first test, and I'm sorry I didn't delve into how Nick Saban was tested.
Sure, of course not.
I know. Well, I should have. But that first test, if it was an antigen test, we know that is often false positive. And so if the subsequent tests were PCRs, those were perhaps more reliable.
Or not done properly.
Or not done properly, and that's why the whole that's what makes this all so much more confusing. You know, we typically tend to trust our test results, and we should for the most part, but we also have to be reasonable and mindful and consider if we're having symptoms of COVID or symptoms of a viral infection, you have to assume these days that it's COVID until proven otherwise. And you cannot necessarily be misled by a negative test result. If you have the symptoms of COVID, better safe than sorry. You better assume and act and function.
What led you to get the antibody testing then? Didn't you say you had your blood tested?
I did misspeak. I have had this assumption. I've not gotten my antibody tested.
I see.
I'm gonna, if I said that, I
Okay,
really,
maybe I misinterpreted, but what I interpreted is that you had COVID and that you now have antibodies.
It's an assumption. I would argue it was an assumption. My wife tested; her antibodies are positive. My son, by the way, who was exposed to my wife when she was infected, my son's PCR test, nasal swabs were all negative, but he was having some mild symptoms. He got his antibody checked and it was positive. So it means that his negative
Tests were false negatives.
False negatives. So no, I did misspeak or maybe said it because I've had this assumption that I've just not gotten my antibodies
Right.
checked because I'm going to mask and distance and behave as if I could still acquire it from somebody or that I could transmit it.
So I really
I'm not taking any chances.
I really haven't gotten to my real question, which is how did you treat yourself? How did you treat your family who had mild cases of it? Did you have them on vitamin D? Talk to me about remdesivir. Talk to me about dexamethasone. Tell me what you do if you've got mild COVID. And naturally, if you've got mild COVID, you don't want it to be severe COVID.
Of course.
So there's this, how can I minimize the damage here?
It's a very interesting question, and it all depends upon your symptoms. So if you're asymptomatic COVID, if you have asymptomatic COVID and you just happen to get tested for whatever reason, maybe you were exposed, there's no treatment we recommend if you're asymptomatic.
Sure.
Okay? But if you are symptomatic but have no respiratory symptoms, meaning no cough and no shortness of breath, then typically we recommend no treatment whatsoever. Okay? Now I'm going to qualify that and tell you about a brand new drug that's out there that is now being used for some folks who do not have any respiratory symptoms. We'll talk about that. But for my wife, who was short of breath and was coughing, she was symptomatic with respiratory symptoms. My wife also had a lot of GI symptoms. So a lot of people with COVID have a lot of GI symptoms, and some folks have only GI symptoms. I had neither, but my wife did develop a cough and shortness of breath, so I put her on dexamethasone or Decadron, which is a steroid.
Right.
It's 1 tablet or 6 milligrams once a day for 10 days. And so that could be taken by either outpatients, folks who are not hospitalized, or those who are hospitalized routinely get it if they have respiratory symptoms with their COVID infection.
Okay.
So that has been...
So she took steroids.
She took it. I think it helped her, made a difference. It's hard to know.
It's
for
hard
sure.
to know in a case of
I,
one.
on the other hand, had a milder case than my wife. I had no cough or shortness of breath. You know, we think those are the main symptoms, but I was clearly symptomatic, feverish, achy, felt horribly fatigued, felt horrible. My eyes hurt. This is weird. My eyeballs were hurting so badly. I know that seems weird. If I heard a patient say that, I was like, "Why do you know?" But I had no respiratory symptoms. I did not take anything. I took Tylenol. I took plenty of Tylenol.
What about vitamin D? Is that?
Some people recommend vitamin D or zinc.
What about Tamiflu?
Tamiflu only works for the flu, for influenza A or B.
Only works for
Only
those
works for
viruses.
the flu, only for those viruses.
Okay.
So I did not take anything but Tylenol.
Interesting. And what is this new drug you were going to tell us about?
So bamlanivimab, I like to say it. It sounds like Bamalan.
Are there any questions out there, by the way? Are we good?
We're good so far.
Okay.
So bamlanivimab is a monoclonal antibody targeting COVID-19 that is indicated, has been studied, and it's undergoing clinical trials, although there now is an EUA, an evaluation under assessment, I believe, to provide it outside of the clinical trial. So that is a monoclonal antibody, an antibody targeting a specific monoclonal antibody targeting COVID-19 that is indicated and has shown some benefit, perhaps, although it's still a little debatable, for symptomatic people with COVID-19 who do not require hospitalization. So they're not sick enough to be hospitalized, but they do have some symptoms.
Who makes the drug, just curious, for our investors out there?
You know, I'm so bad with that.
I understand.
I can pull it up in my phone.
No, it's all right.
But
Forget it. It's called BAM. What again? BAM.
Bamlanivimab.
Bamlanivimab.
It sounds like Bama Land.
Right.
So if you can remember Bama Land, Bamlanivimab.
Okay. That's probably what they should call it, Bama Land.
The VMAB is monoclonal, MAB is monoclonal antibody. But, so it's indicated for people who are at risk for serious COVID.
Gotcha.
So it's indicated for those who are either older,
or let's say you've had cancer,
or immunocompromised people who might get a horrible case of COVID. It is indicated for those people who are mildly symptomatic.
Do you have anybody on it?
We at Grandview have administered it in the emergency room for about 8 or 9 people so far.
Okay.
So yes, it's another tool, and it's again one of those tools that the jury is not completely out. That it's still being evaluated, assessed, but it was felt like the downside, the risk, was outweighed by potential benefit.
I'm going to switch gears on you. Why do people lose their sense of smell? What's that about?
It's smell and taste, and I still don't have mine. So as someone who had a very mild case of COVID, I was afflicted with I still can't taste or smell. It's coming back slowly, I think. But,
what do you think that's due to?
I don't know, and I'm ashamed to say that despite it affecting me, I haven't delved into it. Obviously, you would think the virus has some effects upon cranial nerves.
Sure.
Is what obviously you would consider.
Yeah. It's nerve damage.
So it's a respiratory virus, and viruses attack. The virus obviously attacks organs throughout the body. I mean, people have had syndromes and organ damage from COVID, so presumably it affects some mucosa in the nose or tongue or something, or the cranial nerves themselves.
Okay.
And
I want to switch gears on you one more time. I talk about the vaccine. So I'm going to probably get vaccinated as soon as I can. I just sort of fall in that camp of I believe in vaccines. There's people.
Well, and you're a healthcare worker. So
and I'm a healthcare. Well, I can get in line. Yeah, I can get in line. And I'm probably going to get vaccinated on Doc Talk Live as a statement that, hey, look, I think we all need to be vaccinated. But you have theoretically had COVID. Would you need to be vaccinated?
Yes.
Okay, and explain that to our listeners.
Yes, because again, one does not know for sure how durable or long-lasting natural infection is in terms of inducing immunity. So we don't know how the immunity, the protection that I might have been afforded as a result of having COVID myself, we don't know. Again, I haven't had my antibodies checked. We don't know how long that will last.
How often will we need to be vaccinated? What are the recommendations at this point? Is it every 3 months, every year?
At this point, and that's a great question. I had the same question. I know that the vaccination includes 2 different injections that are 4 weeks apart. So it's 2 injections, 4 weeks apart. But whether or not that's going to be repeated every year, like the flu shot is every year, or whether it's a one-time deal, or whether you might get the vaccination now in 2 different injections, 4 weeks apart, and then maybe your antibodies would be checked a year later, or maybe your antibodies would be periodically checked to see.
Will you check your antibodies before you vaccinate?
I'm curious. This is one of those things where I've been curious and I've intended every day. We intend to do things I will get my antibodies checked soon. I've intended to do so, just out of curiosity. It's not going to affect my mask wearing, my distancing, my avoidance of groups of people. But I will get my antibody checked.
So Billy, I hope you can see by now that we could do this once a week and have lots to talk about, right?
Absolutely.
So I hope you'll come back. I hope this was convenient enough to, because I think this, trying to have a conversation, I want people to participate. I'm not big enough. I'm not NBC or CNN or whatever it is yet.
You're close.
But let's get there, and then we can have people ask their questions, not just me pepper you with questions. But I want to thank them. Give you another elbow bump.
Sounds great.
We'll call it there. Is that okay, Lucy? Are we good? All right, we'll stop video.